What is deep plane facelift, and what are the key differences between the deep plane facelift versus more conventional facelift? In this video, I'm going to take you step by step through the deep plane facelift procedure. With the deep plane facelift, deeper structures of the face are repositioned and tightened, restoring natural, youthful anatomy. Unlike the more conventional technique or skin-only technique, the results are frequently longer lasting, and the results frequently look more natural since we are working on the deeper structures of the face instead of just pulling the skin up. I hope you enjoyed the video. Click like and subscribe with the button below. Thank you. This is where your incisions are going to be. We are going to resuspend and lift deeper structures of your face to volumize your cheeks and to improve jaw and neck contour. This is what's called deep plane facelift, which is going to make you look more refreshed, and so you will look just as young as you feel inside. Doing face and neck lift, so I marked those platysmal bands. So we'll have to address those to create your sharper neck angle and to get rid of that excessive skin. I'm marking your jawline and the jowls, something like the jowls. So we're gonna improve those. We're gonna try to resuspend. We're gonna do deep plane facelift, resuspending the tissues where they used to belong, in the upper cheek area, to volumize the upper cheek and to get rid of this excessive fullness in the lower face. We'll also address the extra skin in the lower neck. And all agree the scars are going to be hidden in the hairline, in the sideburns, in the natural crease in front of the ear, and along the what's called trachea, this whole cartilage there, and then goes behind the ear. And here, where the ear kind of covers most portion of the area behind the ear, we're going to transition it to the hair. The transition, I make it where the ear is going to hide it. Because if you do it below, you will see that transverse scar. Here, you don't see it because the ear reaches the hair. What I'm marking here is the tunnel. So I'm going to create under the muscle called platysma that envelops everything in the neck. And this way, we will create that tunnel and we'll be able to pull the deeper tissues of the neck and we'll anchor them to this area called mastoid fascia. Fascia over this prominence behind the ear called mastoid process. At the end of every facelift we do, I like to revolumize the face, so because when we get older, we frequently lose natural volume in the face. It goes into the areas where we don't like it, jowls, lower part of the face, so we resuspend that back to give nice cheek fullness. We've done that, but I also like to revolumize cheeks a little bit more if necessary with the fat, also the area around the lips and the mouth and the nasolabial folds. So we harvested a little bit of the fat cells from the patient's abdomen and we suctioned it using special cannula, actually this one. And now I'm going to transfer that fat using the special connectors. And they all different diameters, so they go smaller. So transferring that fat into the syringe. And this is all your own autologous fat. You don't need much, a couple cc's, but even a little bit makes a great difference. And now we're gonna what's called emulsify that fat or liquefy it a little bit. So it goes through the tiny little cannula or sometimes even the needle. Because right now it's very granular, it's thick, globular, so it's not gonna go. So we're gonna liquefy it a little bit. So that's what I'm doing. I'm transferring through connector here. Oh, I'm sorry. It was a lot. Oh my gosh, I gotta take a shower now. Yeah, for real. So I'm emulsifying the fat, and now we're gonna transfer it through a filter and transfer it through this mesh filter. So it's gonna retain all the connective tissue and leave us with the emulsified fat, or what's called nanofat. And actually, a lot of those fat cells, they get destroyed during this process. So what we get pericytes, or cells around the fat cells, so mesenchymal cells. And those cells are known for the rejuvenating kind of stem cell properties. So you can see, now I have a syringe. And I should be able to, no, it's not working. You can see, should be able to administer the fat using this little curved cannula. And by passing it through those series of smaller diameter connectors, we're just making it less granular, easier to flow. That's what's happening. Now we're gonna filter it and put it in a smaller syringe, ready for injection. Here comes nanofat. Now use this tiny little, well, it's not a blade, it's a needle. We're done with the facelift. What you can see here, it's actually called hemostatic mesh. I know it looks a little scary, but this is the mesh that keeps the skin adherent to the underlying tissue, so there's no need for drains. And it comes out usually within 48 to 72 hours. And it helps us to redistribute the skin much nicer, also prevents any blood collections or fluid collections in the face. This is a newer technique, about 1.5 cc, you can see. The lip on this side is all wrinkly and deflated, and this one is nicely volumized. And I can massage it a little bit. Again, lip that nothing was done on this. This is the other side. Mesh, described by Dr. Arswald in Brazil. Basically, it helps to adhere the skin to the underlying tissues and redistribute that skin. So we pull the skin up and we obliterate all that space there. And it stays within about 48 hours, we take it out. Doesn't cause any discomfort, but helps us to prevent any fluid collections, any hematomas, any bleeding, and also helps to redistribute that skin nicer for a better result. Ears feel fine?
Oh yeah, fine. Everything's good.
Sometimes behind the ears people feel a little tingly.
No, I've been really lucky. The only pain I get, like more like the jawline and the headache.
Very true. Mary, hey. You by yourself? You look at you.
Huh?
I'm liking it a lot. So she had lower face neck lift with the Hemostatic Net. She had a lot of loose skin laxity. She's just how many weeks out? Just 3, 4 weeks.
Yeah.
So she's just 3 or 4 weeks out, and you can see she's healing up great. So her scar is barely noticeable. It's hidden in the crease in front of her ear, close with all dissolvable sutures. So that's healing up nicely. We did a little bit of a fat grafting to volumize her cheeks a little bit.
Yeah, because I was so hollow.
She was very hollow, and the jawline just looks amazing. It's very sharp, nice. We did that Hemostatic Net to distribute her skin, so her jawline. Show us the jawline, Mary. Look kind of, yes, yeah. You look great, Mary. Behind the ears, yes.
Okay.
Antibiotic appointment, that's about it, okay?
Okay.
And I'll see you probably like one more time, but in like, I don't know, in a couple of months. Just,
Okay.
for final release.
I'll be glad to come back and see you guys.
It's just another occasion, right? Before you head back to Wisconsin in spring.
Yeah, we don't go till June.
June, okay, all right.
Yeah.
You're gonna be here for us.